Hello, everyone. My name is Jennifer Nuzzo, and I'm the director of the Pandemic Center here at the Brown University School of Public Health. The COVID-19 pandemic has imposed unprecedented challenges on the United States. It's revealed stark failures in the public health early rapid response, how we ultimately responded in the years to come. And now that we're entering year 4 of this pandemic, I think it's important for us to take stock of what has been lost. To date, more than 1 million deaths have occurred here in the US alone. US life expectancy has declined considerably for the second year in a row. And in addition to these significant health tolls, we are seeing important social impacts. Pandemic-related learning loss has threatened to erode decades of progress in addressing the achievement gap and improving educational attainment. And we're more now polarized than we ever have been. And there's a real risk that the societal divisions will harden, which could create more permanent barriers to a more effective pandemic response and action in the years to come. But these challenges aren't the whole story. There have also been some positive developments and some successes throughout the pandemics. And it's really important, I think, we also take stock of those. So in the space of research and development, the fact that we had within a year multiple safe and effective vaccines is something that we have to celebrate. It's also important to acknowledge that over time we made important progress in reducing inequities, and in particular around vaccine uptake, also an important area of success. We need to take stock of what went well and what didn't, because we know that COVID-19 will not be the last serious public health emergency that this country will face. There are many other pathogens on the horizon that we are looking at with worry. And as challenging as COVID-19 has been, we know that there are other scenarios that could pose even greater challenges and cause even greater harms to the country than COVID-19 did. We need to ensure that our strategies for dealing with these future threats learns from our COVID-19 experiences and works for the country that we are, and not just simply the country that we wish we were. And so to that end, we at the Pandemic Center have worked with the Center for Strategic and International Studies, Global Health Policy Center, and the COVID Collaborative to organize back in December a senior level roundtable on American democracy and pandemic security. And in that meeting, we brought together a bipartisan cross-section of the nation's top pandemic leaders, people with lots of experience at the state, local, federal level in responding to COVID-19 and other health emergencies. And we brought them together with the goal of better understanding what worked during the pandemic, what failed, and to help us envision how we can repair and rebuild to chart a practical path forward. It was, for me personally, a very eye-opening meeting, and in many ways, actually a reassuring one. It's worth, I think, having a broader conversation about the meeting and about the work that lies ahead in this space so that we can figure out how to come out with a meaningful and effective pandemic strategy for the future. So to help us go through the takeaways from this bipartisan convening, I'm joined by 3 of my colleagues who led this effort. It's my absolute pleasure to welcome Beth Cameron, Stephen Morrison, and Gary Edson. I'm going to introduce them and then we'll have a brokered conversation. So Beth Cameron is currently professor of the practice and senior advisor to the Pandemic Center here at the Brown University School of Public Health. She also currently serves as senior advisor for global health security at the U.S. Agency for International Development. Beth has a long career in government service, and she spent 2 tours on the White House, and we're very lucky to get her here at Brown after her most recent tour.
Happy to be here.
I'm also joined by Steve Morrison, who is the Senior Vice President at the Center for Strategic and International Studies and Director of its Global Health Policy Center. Steve writes a lot, has directed several high-level commissions, is a frequent commentator on U.S. foreign policy, global health, foreign assistance. He too has had a career in government service, having served in the Clinton administration and as committee staff in the House of Representatives.
Thank you. Great to be with you today. Thanks you
for being here. Yeah. And finally, but of course not least, we're joined by Gary Edson, who is the president of the COVID Collaborative. Gary formerly served as the Deputy National Security Advisor and was also the Deputy National Economic Advisor to President George W. Bush. And among other things, he co-led the development of the President's Emergency Plan for AIDS Release, or PEPFAR, which is celebrating an important anniversary and is, in many ways, I think, an inspiration for a lot of big government global health initiatives. So we have a lot of collective experience with 3 panelists, and I very much welcome their collaboration on this effort. So let's dig in. I'm going to take moderator's prerogative and start asking a few questions, but we will open it up to the audience to pose questions. And you can start doing that now. If you're listening to this webinar, you can put your questions in the Q&A section, and we'll be collating them and we'll be turning to them later. But I first wanted to kick off the conversation by turning to you 3 for sort of your perspectives on why it was important that we held the meeting, and for you, what your biggest takeaways were. And perhaps I'll start with you, Gary, because you're right next to me on the screen.
Well, I think there were a number of reasons we held the convening, but I think one fundamental thing, and you referenced it in some of your opening remarks, is that we all now recognize that the U.S. had several pre-existing conditions, comorbidities, that exacerbated the impact of the pandemic. And the first is, I think, a neglected and long underfunded public health system. The second was a social, economic, and racial divisions that resulted in inequitable access to health care. And third, and most pertinent, I think, for this discussion, is polarization, which is increasingly dividing the we the people into us versus them. A communicable virus that doesn't respect borders, race, or party requires collective action. And polarization undermines the foundation for that kind of action by eroding social cohesion. In other words, trust in one another. As a result, what we found during the pandemic was that key mitigation measures, such as masking, became flashpoints, getting a sense of collective responsibility against individual freedom. The pandemic acted as an accelerant on all of those things. And now, as we rush to put the pandemic behind us, and understandably so, these conditions have hardened and worsened. And understanding why that's the case and identifying how we can ameliorate them isn't important just in terms of responding to the next pandemic or even to the next emergency, whether a hurricane or a bioterror event, but for American health security and for the health of our democracy. And we can only do that, we believed, through a bipartisan undertaking, by bridging divides. And that's why we brought that group together that you alluded to in your opening remarks, that included representatives from the Obama, Bush, Trump, and Clinton administrations, that included office holders and public health officials, and included thinkers on both sides of the aisle. And we had a remarkably candid discussion, one that was an eye-opener in many respects, but I'll leave it at that. I think that was the key reason why we felt the need to have this convening now.
Thank you for that. Steve, do you have anything that you want to add to that?
I'd say that we all shared the sense that we were at a profound historical moment as we exited the acute phase of this pandemic, that we were shocked, I think, by where we found ourselves in terms of everything that Gary referenced, that there had been profound political failures at the highest levels and elsewhere. There had been misconceptions about our true capacities. There had been we had landed here in a far weaker spot than when we began. We were living in danger. We were living in profound danger that with weakened capacities in these divisions, that we were moving backwards. We were regressing in terms of our capacity to deal with future threats. So we were leaving our own populations at higher risk than they were when COVID appeared. And that seemed kind of unthinkable, really, but that's where we are. And so that was one moment. Another was the sense of urgency, a sense that, yeah, things are running the wrong direction in a way. I mean, that we're in a moment of amnesia. We're in a moment of yearning for normality. Put this behind us. And all sorts of other factors that are stoking this polarization and disinformation and the like. And so I think all of us came together to ask ourselves, is there an appetite? Is this environment which we described, which is so toxic, is this environment beneath it? Is there a will or an appetite for an honest conversation across the political divide? And are there achievements, gains, lessons learned that we're not seeing because all this noise is preventing us from seeing them? And we were trying to test those two propositions. And those were propositions that were trying to point us towards a hopeful narrative against a very negative narrative. And so my kudos, hats off to all three of you, plus John Bridgeland, for taking up this initiative and getting us rallied around this idea, because you guys had the spark and you really grabbed it and ran with it, and it was really an important thing to do, and no one else is doing this. That's the other thing I'd say, is nobody else has done this, which is kind of shocking in itself, and a reflection of amnesia and pain and trauma. But it took some creativity and it took some courage and ingenuity to do what you did, and you deserve a lot of kudos for that.
And Jen, I'll just say that both Gary and Steve mentioned that we held this meeting in Washington, and I'd say that one of the first and foremost takeaways was that having a meeting in Washington is useful, but very quickly we need to get out into the field. We need to get out into communities. We need to actually get out of the toxic, polarized Washington conversation, because at the community level, and we had a number of state and local officials who attended our event, former mayors, former state health officials, current state health officials from red, blue, and purple states. And what they said was, look, we had to fly under the radar. We were cognizant that there was sound bites being made about every single thing happening in our states and our counties and our tribes, but we had to keep people safe. That was our job. And we found ways to do that, and we learned a lot. And so to get to the amnesia point, it's really hard to talk about pandemics at the dinner table right now. People are not wanting to talk about it. They want to move on, but we're going to forget all of that great learning that went on at the very local level for how to actually take what really were a lot of binary and divisive choices to open up society or keep it closed down, to put kids back in school or to open up, which at the end of the day are not perfect choices, and we need better choices. And we can talk about that as well, and we should. And that's one of the things we really want to do with this initiative, is identify some better options. But at the end of the day, communities actually did make it work and found things to do. And so we really want to uncover that. I'll also say just a huge thank you to the organizations working on this. This is courageous. This is not going to be easy. It is going to get tagged in some cases where we don't want it to, with a political moniker. And so we're just being really deliberate about the bipartisan nature of that this is really about bringing people together that may not agree on everything, but what we do agree on is that we want to keep communities safe and we love our democracy. And those two things have to coexist during a pandemic emergency.
Yeah, so on that point, I mean, in terms of having better options and the level of kind of polarization and the frustration, I was really struck. One of the things we learned in the meeting from looking at some of the polling data was about how America was pretty much on the same page at the start of the pandemic. I mean, there was a fair, consensus agreement in the importance of the response early on, but then we saw that it eroded over time. We're talking a lot about trust these days, but I think what's really interesting is not just that there was no trust and that's why things went wrong, but that there actually had been a fair amount of support at the beginning, but then it changed over time. And so I guess I'd love your reflections on that vis-a-vis the conversation we had in the meeting about the kind of the binary options and the not great tools, and sort of what do we need to do for the next pandemic, given that, you know, America, I think, has demonstrated a history throughout past events of, you know, when there's a crisis, we do sort of pitch in, but perhaps the data show us that didn't last forever. And whoever would like to chime in on that first, happy to let you go in. Beth, do you want to?
I'm happy to jump in. I'll just say a couple of things at the beginning. So at the beginning of this pandemic, I was working on an effort to really look at take a look at the metrics that we had for opening, for keeping, for closing down society and opening back up. One of the things that quickly came to light for me was that we did have data about what, from an epidemiological perspective, a public health perspective, would make sense for community spread, when in theory there was just so much spread that we really couldn't protect people at highest risk without closing society. But what we didn't have was really great tools and methods of talking to people about how to adapt some of those tools for their environment. So for example, what was the playbook for a business to open back up, and for different types of businesses with different types of settings? How could you, and this is something you were focused on early in the pandemic, Jen, that I learned quite a lot from you. How can we open schools in environments where outdoor learning is possible? And these were lessons back from the 1918 flu pandemic. How do we communicate to people about when and how to open back up? And I think that there were just a lot of really binary messages: close, open, not here's a range of options for how to keep people safe. And so from my perspective, having that, it is imperative that we understand what we learned and how to do some of those things, and that we identify the gaps so that we can actually develop better tools. Because at the end of the day, people are going to go out and go about their daily business. We found that out. It's very challenging to keep society closed off for very long periods of time. But we also had great public health risk to people at high risk of mortality. And so we just have to be able, we have to get a better set of tools and options that people understand and that are readily available. And it's going to be challenging, but it's quite critical.
Let me just follow up on that with something. One of the things that this convening highlighted, and one of the things that we learned, is that pandemic response and mitigation are not as simple as just following the science. And you'll recall that that's the mantra we kept hearing repeatedly from the CDC and public health officials. As one participant in the convening said, if it were that easy, all the scientists would be governors. And what the discussion revealed is that first, the science is uncertain. Our learning was evolving, the virus was changing. All the participants felt that there was a lack of humility on the part of public health officials and some elected officials as well in the face of that uncertainty, and that changing guidance undermined trust. You mentioned, Jen, that trust that existed at the outset, as did a failure to openly and candidly admit mistakes as they were made. And second, there was a recognition that there are different views of the science. And some people felt that dissenting views were given an insufficient hearing, and that one person's misinformation was another person's information. But most importantly, what the convening revealed in a very candid discussion between office holders and public health officials is that, as a practical matter, and this picks up on what Beth was saying, the science needs to be balanced with the social, educational, economic impacts. Too often, instead of bringing key community stakeholders together to weigh all those factors, we had what Beth referred to as these stark either-or choices, protect the economy or protect jobs. In effect, your money or your life, rather than finding solutions that maximize the protection of both. But as Beth said, we did hear that in some states, red, blue, and purple, that they formed fusion cells and ad hoc combinations of stakeholders that managed to weigh those various factors more judiciously and more thoughtfully. We need to understand what occurred at that level, see if we can identify models that can be replicated as we move forward here before it's too late.
May I just add a few
Yeah.
thoughts to what's been said, Jen? We, in the course of the pandemic, there was a proposition that emerged that public health values were antagonistic to democratic values, that you couldn't have both, and that public health and public health interventions were elitist, insensitive to other societal concerns, stuck in a mindset that didn't have sufficient communication skills. Communication was terrible, wasn't thinking broadly enough. That was one of the propositions. The other was, we entered the pandemic thinking that we were quite well prepared, but we didn't take account of political leadership, and that political leadership choice could go in the wrong direction. Now, obviously, when we look back, Trump himself made many different big choices that profoundly moved the picture. He was not alone by any means, and he doesn't. And there are many others, but we weren't. We were overstating what science meant, and we were understating what the politics and the political choices would be. And we also saw the need to reaffirm the fact that democratic values of freedom and individual choice are not antithetical to seeking common protection of communities.
Yeah.
And that we needed a different language and a different way of going about that. The other thing I want to mention is that this pandemic has left us with a massive amount of anger and frustration in our society. And it's manifest in some ways in active measures to assault and limit the power and authority of those in public health domain whose job it is to protect Americans. And so 30 states have swung that direction. We see investigations appearing on the Hill that seem to be vengeful and based on this grievance narrative that bad people in our public health sphere made bad decisions for bad reasons. This effort, we're trying to get a different kind of dialogue going that is more inclusive, that listens carefully to the perspectives of many different political outlooks, and is respectful of that, and move forward from that vantage point. So in some ways, we're going against a set of currents that are moving us in the opposite direction. And as Beth said, that may open us up to a certain amount of targeting, because the narrative we're putting forward is not the narrative that's being brought into the presidential campaigns of some candidates.
At the same time, I think, Steve, we also want to provide those people, both sides of the aisle, with a different narrative.
Yes.
This issue of public protection, pandemic preparedness, and freedom of democracy, and how they must cohabitate to keep America strong during a crisis where we should become national crises, should be unifiers at the state, local, and federal level. How do we provide a different narrative? I think the only way that we can do that is by going to the communities and finding out and talking about what actually worked for real people, and how we can make that work again, as opposed to talking about what didn't work or focusing on only one of the things that didn't work instead of the multitude.
So we need to harvest the really positive stories and the positive experiences, but we also need to have a pathway forward that is very pragmatic and concrete. Right? that's less ideological, but more that plays on people's sense of pragmatism and a desire to do better, because our leaders of all ilk at state and local level in particular are very attuned to protection and want to do, most of them want to do the right thing and not engage in performative art.
Steve, you used a really important word earlier, and that was listen. We need to go into these communities and listen first and foremost. You know, I think that a lot of people felt that pandemic response was something done to them, that there was a lack, they weren't listened to, there was a lack of agency, and that these measures were imposed and done to them rather than with them and with their participation. And I think one of the key things that this initiative is going to do is listen to all those various perspectives, so that we can understand what really happened and think through how to do this better in the future.
So Steve referenced the kind of rollback of public health powers in now about 30 states. And this is really stunning to me because my professional career was shaped by the events of September 11th. And I remember the scramble after September 11th to make sure that our state public health officials had the tools they needed to be able to respond quickly were the United States to be attacked again. And that's the reason why many of the states adopted modern public health powers that we're now seeing rolled back in the states. So in my career, just seeing the bookending of these issues, that we came out of a crisis recognizing that we needed more tools, and then following this event deciding to erode the tools that we have, was really quite stunning to me. But one of the worries that I have is that for many people, and you all sort of referenced this, and Gary, you particularly referenced this in talking about how people felt like public health was done to them, the pandemic response was done to them, is that, you know, public health is, at least in the modern era, you know, really not one of focusing on restrictions. You know, it really works best when we're seen as social workers. And yet, you know, the pandemic in many ways forced public health into more of a regulatory law enforcement role than, you know, we had ever been. And I'm so struck by how that's different from kind of global health best practices, when we very regularly talk about the importance of engaging with communities, making sure responses are aligned with their values, making sure they have input, because we have recognized in global health contexts that it's very hard to implement without the community's support and buy-in, and that we have to invest time and effort making sure that we have that. And so you all have worked on global health for your career, and Gary, you know, celebrating the 20th anniversary of PEPFAR. Just would love sort of your reactions on where we are in public health and on that engagement piece.
Well, I think you hit the nail on the head in many respects. Unfortunately, most people's first interaction with public health was negative through this pandemic. It was locked down, shutter your doors, don't go to school, don't send your kids to school. And I think that is driving a lot of the state action that Steve was referring to curtail public health authorities, because they're viewed as punitive, not as advantageous and not as beneficial. So we need to change that narrative. We almost need to go back and educate people what public health is for. You know, did you know that public health does X and Y and Z? That keeps your water safe and your restaurants clean. That there are things that the public health community does every day that the public doesn't see, that they need to be reminded of. But the other thing is the way in which public health was divorced from health care in this country in so many ways, and we need to bridge that divide and bring them together going forward.
Yeah, and go ahead, Steve.
I'm really quite worried in a couple of ways. One, about public health institutions. I mean, they were tested. Their skill, their abilities were tested way beyond anything that anyone had imagined. They were overwhelmed. The decisions had these broad, profound societal impacts. Their political acumen was oftentimes very limited. Their communication skills were often very poor, and overwhelmed by disinformation and counter narratives and the like. And now it's a sector that's been depleted and demoralized and is quite wounded. And so what do you ask of them now? You know, that in other words, there's a certain amount of reinvention that needs to happen in outlook, in skill sets, in political acumen and communications. But we're a long way away from that when you look at the flight of key staff, skilled, seasoned staff in those institutions who are worn out, besieged, angry, ready to move on. And so I think we do have a national challenge across those 3,000 public health jurisdictions in our country. It's not uniform by any means, but I think that this listening engagement, this coming up with pragmatic things, but we also need to get the political leadership in those states in thinking and engaging in a new way, so that the siege will end in those 30 states and evolve towards something that is more constructive. Just like what we see up on the Hill in the congressional investigations. Right now, they're grievance driven. It's a retribution narrative. It's not a constructive narrative. And maybe we need to sort of go through this venting of anger and frustration, but it's tied to political campaigns as well. And it has legs. So what we're trying to do, I think, really requires us to be able to open a dialogue with elected leadership that's very diverse and empowered, and in a way get them to rethink a bit about what is it that they want to have in their own communities and their states.
I was just going to also jump in to build on something that Gary said about community health. And you brought this up as well, Jen. And it's something that we talked about a lot throughout the pandemic. Who are the most trusted sources of information for people? It was a primary healthcare physician when they had one. I think for community health, most people don't identify community health with the person that they work with. It's a regulatory agency that does something to them, or it's CDC, which is a federal entity. And for many of us, we know what the CDC does, and we know people that work at the CDC, but at the local level, you're not thinking, who is that person and what are they doing for me every day? And how can I get information from a real person that I know? And so I do think that one of the things we want to surface through our efforts going forward with this initiative is, what can we do in this country that will ultimately improve the relationships that people at the community level have with public health officials? And how can that public health conversation be skewed more towards a public service, a customer service kind of approach? What am I providing? How do we make it more clear to communities what they get, and at a personal level? And then I do also think that it's a comment on how our healthcare system works. I think many people in this country don't have a regular primary healthcare physician that they view as their community health leader. And in some countries where that was the case, we did see some best practices from the pandemic coming out, where people had a place to go for trusted information, trusted and nuanced conversations about what we knew and what we didn't know. I also think that there's a room in the future, and we've all talked about this, for some more national, geographically broad, diverse groups of people to come together with consensus recommendations, where people can say, that person thinks like me, and they're sitting next to a person that thinks like somebody else. And we have a broad, diverse range of people who are making some consensus recommendations, or at least some recommendations about what they agree on and what they don't agree on, or what they don't know yet. And I think instead we saw a lot of independent people emerge, and some of those people either were polarized or got polarized or were politicized. And so I think we have work to do to create better, more nuanced conversations about pandemics nationally, and to have a stronger community health approach to public health in this country. And hopefully we'll also surface lessons so that we're not just talking about breaking glass scenarios for how we deal better with a pandemic response, but actually we'll learn how to deal with day-to-day health threats a little bit better as well.
Jen, can I add just
Yeah.
one thing? We ought to emphasize that these conversations that this initiative is going to have are not only bipartisan, but they're not just with public health and health officials. That we are going to, Beth raised the issue of, who are the trusted messengers within communities. Well, we're going to have as part of this dialogue and crowd into it the business community, the faith community, the education community. That multi-sectoral, bipartisan conversation is something that hasn't occurred in this country yet. And that's what's going to make this initiative both unique and, as Steve said, so urgent that we have it.
Yeah, frequently we put businesses in the driver's seat of making decisions and people trusted and looked to them because they were the ones that were had to give them daily information about what to do. And I couldn't agree with you more, Gary.
Well, I mean, pandemics, I think one of the hallmark lessons of COVID-19 that's been demonstrated quite clearly is that the pandemic touches all of society. It's not just a health issue. And we've seen these effects in multiple areas, and yet we don't really have the mechanisms for engaging these other sectors and these other considerations. It shouldn't be health or economy, but health and economy and schools and all these other sectors. So I want to turn to questions from the audience, and I'll let folks continue to put their questions in the Q&A box. But there's already one in there, and you've already started to touch on this, which is just, moving beyond the convening. Will the group meet again in the future, and what are its planned engagements? Do you want to speak to that? You've spoken about it a little bit in terms of conversations, but do you want to talk a little bit more specifically about some of what we're thinking in terms of the how-to?
Beth, why don't you take that up?
Yeah, I'm happy to start, but you should jump in. So we are very much scoping this effort, working with experts, and really welcome. First, I should say to this webinar and people that tune into it, people who are watching it, we're very open to getting views on how to do this and who are additional leaders and community leaders in particular that can be part of this. But we're really interested in hearing from you. We want to really start with a series of state and local dialogues that will consist of convening diverse officials, private sector engagements, community listening sessions. And we want to start in a few different types of states. So states that are red, blue, or purple, states that did well or had specific different types of approaches, states that are dealing with different types of populations. And we really want to get some convenings going to actually hear what worked, what didn't work, and what they think could work. And we want to develop a methodology for doing that so that we can consistently mine the best practices from this pandemic and do it in a really deliberative way, which we don't think, as Steve said at the very beginning, has been done before. We want to do it in an explicitly bipartisan way. We want to have a group of experts that are providing counsel to this, that are explicitly bipartisan, and which include figures from both sides of the aisle, and prominently so, because we don't want this to be seen as an additional polarizing effort. We have to really be very deliberate, and are being deliberate in how we do that, so that it is explicitly a pragmatic, forward-facing approach to this, and not looking to assign blame, but really to listen and to learn. And then coming out of that, we really want to use those lessons to be able to develop some of the tools that you mentioned, Jen. But I'll maybe just turn to Gary and Steve to talk a little bit more about how we're going to set up some of those dialogues, and also the great work that COVID Collaborative has done in some states to date that we're building on, as well as Steve, the Commission for Strengthening America's Health Security, which you utilized really, I think, quite effectively during this pandemic on issues like you and Catherine Bliss on issues like vaccine confidence and vaccine uptake. So we're really building on some groundwork that's already out there, but we want to take that learning, get an explicit methodology of looking at a few states, and then we want to adapt that so that we can do that more broadly across the country.
Gary or Steve? You've been handed the mic.
I was just gonna, Beth's comments raised a question, and that is what worked and what didn't work. She used that phrase, and we use that phrase as we're discussing what we want to do. Identify what worked, what didn't, and what could. That begs the question of how you define success here. And we've seen lots of studies done, cross-state studies, comparative studies, and there was a new one out in the Lancet just recently that compares state outcomes. And the rankings differ depending upon the metrics used. If you're looking at health outcomes only, you get a different kind of ranking. If you weigh health outcomes together with education and economic outcomes, you get an altogether different ranking of states. I think at the end of the day, the definition of success is going to arise from these dialogues themselves in terms of people's views going forward, in terms of the trust that they have in both elected and officials and public health officials, and in terms of their willingness to adhere to public health measures in the future. And I think I'm hoping that we're going to discover some new insights that way, but we're not going into this. I just wanted to make it clear with a view that X state succeeded and Y failed. What we're doing is we're trying to figure out what worked for the people in that state, and the people defined to include all demographic and political groups, rural and urban, et cetera. So that, I think, is going to be a major part of this initiative.
We're running up against a tough historical background, right? I mean, after the 1918 Spanish flu, Americans, we lost 670,000 Americans. America was a third the size it is today. And there was a radical turning away. World War I had ended. There was a radical turning away. There's only one memorial in this entire country to the victims of that. We've lost 1.2 million people. We're losing 250, 300 a day. And it's been really difficult to get consensus around a national commission for such a profound and traumatic thing. And so what we are trying to do here is running against the grain of that historical background. And that means that we have to be very deft. We have to engage in a new kind of storytelling. We have to be very creative and dynamic and fast and fresh and show ingenuity and openness. And we have to deliver concrete results to motivate people, because people are motivated to move away from this topic, not to move towards this topic. And so the ideas that have emerged are to get these dialogues going, in which we will harvest from those, to begin rethinking the tools that we use, the kinds of interventions which need some adjustment and some refinement. So people will look again at these and not dismiss those tools. They need to think again and say, look, we've learned some lessons. The tools look different. They're better. We need better data. And that quality data is reliant on those who control the data. And we need quality and consistent and fast data. and not get hung up on not having the perfect data, but to have data. And we need better career training, and we need to focus on the kind of command structures, the way in which these emergencies are handled, what are called the incident management structures. These are all very concrete, pragmatic things we're talking about focusing on. And I think if you get people of goodwill focused around those concrete things, that's where I think we can pull people in, as long as we're delivering results that are meaningful and we're doing it fast, because I think patience will run out on this fairly rapidly unless we show that we're doing something that's not been done before, bringing people who are skeptical or openly antagonistic to talking about this topic to the table and getting them engaged, which will give a new optic. We haven't talked much about governors and mayors. Governors and mayors are going to be vitally important to the success of this. We've tested the waters on a few of them, and the results are very promising. And I take a lot of hope from those early tests that show that they are open for this. And how long they'll remain open, I don't know. But I think that's another thing to keep in mind, that this dialogue, Beth made the reference, look, this dialogue's not going to happen up on Capitol Hill at the moment, where we'll just get torched. It's going to happen somewhere a little farther away from the highest point of toxicity, and into finding those places where people with real political power are willing to think again about what this all means.
Yeah, I'm hopeful that people at the state and local level, and people who ultimately are going to be running for office in the next couple of years, are going to be looking for positive stories about what happened in their local communities and their states. And there will continue to be an overarching mantra about this, but I think we have to find ways to push back against it, and use pragmatic approaches to chart a better path forward. Steve, I'm glad you brought up incident management. One thing that I did want to say that came out loudly and clearly in our convening, we had a number of people who found themselves in various positions, from people who were on the news to people who found themselves in Secretary of Health positions working for governors, to people who were at FEMA during the crisis at the Federal Emergency Management Agency. These are pragmatic people who go out in vests and waders and are putting down the sandbags during various hurricanes around the country. And they were the ones at the end of the day that had to get down to brass tacks in communities and make sure there was enough PPE, make sure that there were vaccine sites that were stood up. And they didn't have the tools they needed, but wow, did they want to come and talk about how we need to do a better job of unifying our incident managers across the federal, state, and local level, and that there are best practices there with some of the fusion centers Gary mentioned. And there are best practices with networks like STAT, the testing operators network, that brings the people who had to figure out how to operate these systems together to solve problems. And the bad news is those things are going to go away. A lot of them are philanthropically funded. The funding's going to end. And we need to make sure that those are captured and that those are sustained. And that's something that we also want to do.
Let me just quickly add one other thing that we haven't mentioned that's a central focus of this, which is equity. I think that we are confronting head on. And Steve is absolutely right. We need to crowd into this dialogue. People, not only on both sides, but people who are even antagonistic towards public health, et cetera, they need to be part of this dialogue, and we need to seek practical solutions. We're confronting two very stubborn things: polarization and the inequities in the system. And the way I think that what we're going to do by focusing on the pragmatic and at the local level, and Jen, you alluded to this in your opening remarks, there are states, there are cities that were able to mount a more equitable response in terms of vaccine, in terms of other interventions, and we need to learn from those. And that's going to be a key way to solve these the inequity problem that's so embedded in the system. It's going to take action not only from the top down, but action from the bottom up as we learn through these dialogues.
So maybe to summarize, that what it is hopefully aiming towards is giving communities a longer menu of options to choose from, and to point to some of the high priority areas, such as addressing inequities that, you know, underpin some of our biggest vulnerabilities in this pandemic. There's a couple more questions in the Q&A. I'd like to see if we could just get to them in the next couple of minutes. One is a particularly pertinent one, which is that if you had to make a formal evaluation about where we stand today in regards to our preparedness for future COVID waves or future threats like bioterrorism, future pandemics, et cetera, where do you think we stand as a nation to respond quickly and effectively? I think I know the answer, what you're all going to say, but I'd like to hear from each of you. Steve?
I think we are in a perilous condition overall, and a position that is in many respects quite a bit worse than where we were pre-pandemic. I will contradict myself also in saying that certain things have happened institutionally and experientially that will benefit us going forward if we can fix some of these regressions and some of these institutional failings and get the heads of our political leaders in the right place. We have seen some improvements in our data collection. We have seen a change of consciousness among many people about what this all means. You can't go through something as profound as what we've experienced and not be changed by it. Yeah. And yes, we're traumatized and we're engaging in amnesia, collective form of that. But we also are carrying a set of experiences in ourselves that the next time we're not going to have to be educated to the same degree about what we're talking about when some dangerous pathogen pops up, and we're thinking, how the hell am I going to protect my family?
I heard somewhere that we no longer need any more tabletop exercises or consciousness raising events because we've collectively lived in. Now we need the functional exercises in order to figure out what to do about it. But Gary, what do you think about our preparedness for future events?
I am in violent agreement with Steve on this. I think that we are seeing again the old cycle of panic and neglect. And I fear that we're also, as he alluded earlier, particularly as we see what's happening on the Hill, we are in a process of trying to fix the blame and not the problem. And until we start going down a more constructive path of problem solving together collectively as a nation, we're going to be at risk.
Beth?
Yeah, I too am both hopeful and incredibly nervous, kind of at the same time. On the one hand, we have made such great advances in technology and research, and not in all areas, but in many. And I think that, you know, for the next pandemic, we will definitely be better prepared to capitalize on those learnings. I think that we need to be careful that we don't think that we are ready for everything that might come our way, because there were some convergences of research and development that allowed us to move more quickly with the coronavirus pandemic than potentially for some others. But we are in good shape. The challenge is that our community health system is exhausted. People who work in the space, from policymakers to practical physicians on the ground, are all exhausted. And so I am worried, back to the point I think that Steve made about training and providing infusion for the next generation of people who are going to take these jobs, and for the current generation who are in these jobs and exhausted or targeted or having challenges or trying to move up and get promoted and unable to. We really do need to find ways to support them and to provide the tools that they need in order to keep going. because if we don't have them, we will not be able to withstand the next pandemic. And that is the concern that I have, not just in the public health community, but the American public is exhausted. I'm not sure that we can convince people to do all of the things that did protect us in the beginning of this pandemic, because I think people are just really tired. So we need to do better. We need to harvest those concerns, and we need to listen to them fairly and provide some next steps that are pragmatic and useful.
May I just add one remark to this? Despite all of the challenges that we've talked about here, people are coming to universities to seek out career paths, right? And they're still coming to Brown University and enrolling in programs. Somehow this experience has had an inspiring impact on youth in some respects. And that is a very important thing to keep in mind, because I think universities are where you have the potential for major innovation in understanding the requisites, the politics, the technology requirements, the capacities required, the political strategies that are going to build new allegiances and do the rethinking. And you guys are, Brown School of Public Health has to become, and already is becoming, one of these laboratories of innovation. And that's terribly important. The other point I'd make is the kinds of coalitions that formed sui generis in this period, and those that were guided in forming that the COVID collective played such a vitally important role. The lifespan, I don't think Gary and John Bridgeland believed that they were going to operate in a very long-term range, but they find themselves still very, very active in this post-acute phase moment. And there's a reason for that, because what they demonstrated was the vitality and the central importance of these coalitions that formed in distress, in adversity, but were creative and they were overcoming and finding solutions, overcoming challenge and finding solutions, and they remain very important in this equation. So I think we need to keep reminding ourselves of the centrality of the university environment and what that can do, and the power of that, and the power of these coalitions that have formed in this period.
Thanks for that, Steve. That's a great hopeful note to end on. When I ever feel sort of frustrated or pessimistic about the future, I very frequently draw inspiration from our students and young people who, don't have the luxury of burning everything down like some in government seem hell-bent on doing. They very much are pushing for building a better and healthier, happier, more just future. So that's a great note to end on. I'd really like to thank you three for joining us today for this really excellent conversation. We have spoken together many times, and I continue to learn from you all, and today is absolutely no exception to that. I'd also like to thank my Pandemic Center colleagues, Leah Lovegren, Bentley Holt, Akwiel Person, and Andrea Ulig for their help in making this webinar happen. And if you're listening today, and if you'd like to share this event with anyone who is unable to attend, the recording will be posted on our website probably sometime next week. And you can please follow us on Twitter at Pandemic Center. That's our handle to learn about all of our events, future events, and our monthly webinars. And please feel free to reach out if we didn't get to answer your questions, or if you have suggestions for future webinars in our Pandemics and Society series. And thanks so much for your attention and for the great conversation today.
Thank you, Jen.
Thank you, Jen, for pulling us together.
Thank you.